We have Dr. Kannav Kohol with us today. Kannav, Division Head, Affordable Health Technologies Division, Public Health Foundation of India. Kannav, an expert on biomedical informatics, quit his job, a teaching job in the United States, and came back to India to create a technology for India. He's created what we know as the Swasthya Slate. Let me have a show of hands of how many people know about the Swasthya Slate. All right, so Kannav, you surprised. So when I went to Kannav's office the first time, and I'll come to that experience a little while later, he's created a Swasthya Slate, a mobile diagnostic tablet for frontline health workers that can conduct 33 diagnostic tests. The Delhi government is the latest to make Swasthya Slate an integral tool in its mobile mohalla clinics. He focuses on integrating information, mobile, and sensor technologies to create access, efficiency, and accuracy. So about 4 weeks back, I actually walked into his office, a lovely office in south of Delhi. And that's the first time I got exposed to, I'd only read about Swasthya Slate. I first time got exposed to Swasthya Slate. With 1 drop of blood, I don't know how many tests did he perform on me. And I was actually amazed. And then he tells me a while later that, Varun, I'm also working on something that's called the Chem Slate. Is that right, Kanav? And he said that this 33 number will actually grow by 100 and get to 133 tests on the same platform. Now, to me, and we also work in the diagnostic space, that's what we call disruptive. And if we can do that in India, create in India, manufacture in India, and start to supply to the government of India, and that's a big, let me tell you, that's a big success factor. So I think over to you, Kannav. I can't explain that beyond.
No, I think that's perfect. Actually, the chem slate's ready. And it's 133 tests plus the 33 tests, so it actually comes. And we've got the 33 tests up to 50. So it's around 183 tests that we can actually do on this platform. But I think where the concept of India really comes in is the fact that we have frontline health workers who do it. It doesn't require trained individuals. It can be done by anywhere, anytime. The results are given instantaneously. We are in places like Leh, we are in places like Rajouri, Punch, where, to get an antenatal care visit, it used to take 14 days, and now you can actually do it in less than 45 minutes, anywhere, anytime. And that's better than Delhi. For example, Delhi also an antenatal care visit is half a day where you go give your blood in the morning and by the evening you get the results. But what I thought I'll do, and I mean, so much has already been sent, and I know I stand in between you and lunch, so I don't want to bore you too much. But I do want this audience to focus on Make in India as an empowerment tool. Let's not forget that we've got 1.3 billion people, and today the healthcare industry services maybe 5% of them, right? And that to me is unacceptable. We need to create technologies, we need to create systems that actually are designed for the remaining 95%. And that's, by the way, true worldwide. Even worldwide, every technology, every piece, whether that's a MRI machine, all of that's designed for maybe a billion of us. A billion worldwide. And then there's the 5 billion of us who are just waiting for these technologies to get cheaper, to get more affordable so that we can afford it. Why don't we actually start creating it the other way around? Why don't we actually create technologies for the 5 billion? And the 1 billion will automatically get it. This is true in the way we've done healthcare. We all wait to get really sick to actually access healthcare, right? We don't do that to our cars. We're quite good with our cars. We actually don't wait for our car to fail, but we do wait for our body to fail to show up to a doctor. And I think that's the way actually all of this has been done. Make in India, for me, in the healthcare industry can be about empowerment. It can be about the fact that we are making things for India. It can be about the fact that this is an industry that can actually generate a significant amount of employment. A PHFI report did talk about the fact that we need around 6.5 million people to be employed within the healthcare sector, in the healthcare allied health services. Today we don't even have I think we barely have 1 million of them workers. So there is a way for us to actually look at Make in India as an empowerment tool. There is something unique about India. When you talk about the numbers of India, current methods and paradigms don't really scale up. I once asked a question which was, how many blood pressure machines does this country need? Or for that matter, how much money will the country spend if you actually look at the diabetes epidemic? And when you actually start adding up all these facts, the fact that a diabetic patient will require a test every week, the fact that we're going to have to go through urine protein, urine tests, many of them may develop dialysis, then their hospitalization, syringes, you add all of that up, it comes to around 0.8% of GDP just on diabetes care, given the current methods and the current medical devices that we use. So we do need innovation, and we need that innovation to come in really, really fast. We are in a unique time right now from a historical perspective. I do believe that what India is doing is very, very unique, and I think 15 years from now, we will look back at this as maybe a golden period of what's going on in the innovation space. But that's where the role of FICCI comes in very, very deeply. We need a documentation of this process. When you were talking about plastic blowing industry, I actually really busted my backside trying to find a plastic manufacturer in India. And I couldn't find one because there was a database, but nobody really told me what the quality of this guy was. So I was going from one person to the other, and everyone was a Punjabi who said, "Ho jayega." And I swear to God, how many ho jayegas didn't translate into anything. If I had a penny for that, I'll be probably a reasonably rich man. The problem is that we are actually suffering from industry bodies talking to each other, right? We don't actually know where the reliable people are. We don't actually. I mean, I often joke in India, in Delhi, for example, there are two people who work in a factory. The owner, who knows nothing about the machines, and the technician who knows how to press 5 buttons on the machine. And if you tell him to press the sixth one, he'll never do that. There's no knowledge in the middle of how do you actually create products in India. And that's something I've really struggled with. In fact, my academic career, I was a faculty in Mayo Clinic. I continue to be a faculty in New York Academy of Medicine. It's taught me nothing about making in India. So that's another aspect of this, right? How do you actually make stuff? How do you actually convert an idea into a concept? A concept into an actual product actually needs to be documented and studied. And I strongly urge FICCI, that's why I'm actually here today, is to urge FICCI to actually start documenting this process and make it easier for guys who are 20, 25, who want to get into the healthcare sector and invent something new. They have brilliant ideas. Swasthya is nothing new from a concept perspective. I put 5 of you together in a room and say, what would you like from health technologies? You'll probably come up with the software requirement specifications of Swasthya. But the problem is none of you would then know how to convert that into a product. That's all I've done. But it shouldn't be this hard. It shouldn't be this hard. It needs to be simpler. We need organizations like FICCI to stand up and really, really move in that direction of creating this body of knowledge, which a lot of people can actually leverage. Another point is we have to use India's scale to our advantage. I've talked a lot about skilling, but also moving to preventive care. There is no way India, in my opinion, it'll be a great investment to just keep on creating more and more hospitals, right? We need to invest in primary care. The only way you're going to be able to do that is if you actually come up with technologies, come up with methods and paradigms that actually allow for prevention to happen. As I said, if it's going to take 0.8% of my GDP just to take care of patients who are diabetic by the year 2020, maybe I need a different method. Maybe I don't want people to get to diabetes, right? I want technologies that actually prevents them. I mean, I've worked on video games that make people exercise. That's one way to do it. Maybe some of these bands that are coming out need to be expanded and made a lot more intelligent, and they shouldn't just go up every time my car hits a pothole, which is the national right of every Indian who travels on roads. We really need to develop better technologies that are around this prevention scale. And the world is looking at us. I strongly, strongly believe. I mean, I was at the Global Call to Action last week, which had around, I think, 22 countries. Our Prime Minister Narendra Modi was there. He actually saw the Swasthya, which was a nerve-wracking experience, but good in the end. He was actually there, and we actually, what was great and what was very palpable was that the world is looking at us. I mean, we are the ones with actual growth in the GDP. We are the ones that is actually right now the darling of, or the apple of everybody's eyes. So there are people looking at us and going, what have you come out with? And it cannot just be a copy of a blood pressure machine or a normal blood pressure machine that has just been made cheap. people are looking at us for innovations. So for me, Make in India is about that. I think manufacturing is a very, very critical part of it. You have to make it easy. You have to make the processes simple. But fundamentally, you have to invent in India, for India, and of India. And again, I really do want to end with that FICCI has, I think, a great responsibility, maybe even partner with LinkedIn to actually document this process and create these bodies and social networks that can help other innovators come up with new technologies and innovations. Thank you.
Thank you, Kanav. As expected, you were at your best. One of the things that he didn't talk about is that he's able to talk like this, innovate like this, because he feels from the heart. And that's what I probably saw when I went to his office. Kanav, you've kind of added another term that Make in India can be looked at as an empowerment tool for the country, and I think that's a big statement to make, a very powerful one as well. The other piece that probably I'd want to allude about the product that you've created is that product is a sub $1,000 product. Yeah, significantly lower than $1,000, including the cost of the tablet that he has, which can enable 33 tests. As he says, it's gone to 50 now. It has integrated analytics. So it's not only about data. It's not about only the patient who's done his testing done getting the reports. It's actually integrating the entire data piece, moving the data to fact, information, knowledge, and then converging into wisdom is what is going to change the way we look at diagnostics in India. So thank you, Kanav, inspirational as always. So I do believe that innovative methods will be able to lower the costs of manufacturing and to a large extent reduce the market prices. So the next speaker today we have on the panel, they've succeeded in doing this for the last 35 years. And ladies and gentlemen, I'm talking about Ms. Mala Wazirani, Executive Director from Transasia Biomedicals, a company that's been into existence for 35 years, a diagnostic company. They sell diagnostic equipment, reagents, and YSP actually spoke about it, not only in India, but in 100 countries. So Mala, with that said, what's the opportunity that we have in India? And what is it that you want the audience to know as to how to create an organization this size in India, and then to be able to go across the globe?
Thank you so much. Now, we've had very interesting talks from all our earlier panelists, and it's given me great hope. I mean, that there can be really some serious answers. We started 35 years ago. My husband started with this thought that for a developing country, it's really essential to have preventive care. So that was the whole idea, and that sort of empowered or powered us through these 35 years. Today, yeah, we are in a lot of countries. We have, on an average day, about 2 crore tests are done of our systems. 80% of them in India, 20% of them around the world, and growing by the hour, I would say. So it's a big job to keep them going using conventional technologies. We work extremely hard. It would be nice, Kanav, to be able to work smarter. Currently, we have over almost 800 people on the field to support the Indian installations. We have about put out there, I think currently working over 35,000 analyzers of all different types. Pan-India, from Leh to Kanyakumari and across from the border to, borders of Burma in northeast. We have a team that goes into even these dangerous places to provide service. They don't do it for the money, I can tell you, but they do it because these are special guys. Kanav is sort of like, the kind of spirit that has powered you and got you to come back. So, yeah, at Transasia, it's a passion to be able to serve, our patients in this country. Profits are important to us because they help us to grow. How we got here, it's quite crazy. I am not really sure how we got here to this point. We didn't have a brand, we didn't have money, we didn't have capital, we didn't have technology, we didn't have know-how, we didn't have any assistance or subsidies. But we did have this deep determination that we're going to do something to change the situation. Going back, I mean, where does this power to create an organization like TransAsia that's, I mean, we have numerous awards and for many, forums, and it's because of a different attitude. Our products are very me too, or maybe sometimes a little bit less than me too if necessary, but our commitment goes way beyond me too. And I think that more than, that's kept us going. And so our products are now even better than Me Too products. And we are able to do that. For us, it's making it happen, making the scale grow, doing what it takes to get more people to be able to access this technology. Sometimes there's a gap because, okay, there are other costs involved beyond just the technology. So we have to look at those, in how you get across to a greater number of people. But yeah, it's a huge commitment. And I agree with Kanav that there's a need for new innovative technologies. It's very exciting. Uh, we'll be very happy to see these technologies coming in and try and be part of them wherever possible. So I personally think that the power is not in the money, it's not in the technology, it's not in the know-how, because otherwise we would not be here, and we would not be India's biggest diagnostic company. And some multinational companies will think that we're kind of a threat to them in some market segments. Not only that, we're not just India's biggest diagnostic company, but we are also an Indian MNC. We have acquired almost a dozen companies overseas. We have manufacturing bases in the United States, in Italy, in France, in the Czech Republic. And these are churning out products for both India as well as the rest of the world. So we're also a global employer beyond employing about over 1,000 people directly and keeping about 4,000 people working round the clock at our vendors' end. So this is all possible. We are paying taxes in all these countries. So I think it can, if you ask me, I think somewhere it's got to be inspired work that goes beyond just wanting to have, a financial success, come out with an IPO or have a great market share or a great market cap. We never think about these things. It's just how far we can go with what we have and how many people can benefit from it. And somehow when we think like that, the other things all fall into place. That's my personal experience. So, and we make friends with, the best kind of people. Like I've been sitting across here. Old friends, really. So, where did we get this inspiration from? My husband happened to be party to a conversation between Dr. Mani, who was nephrologist to Jayaprakash Narayan, and Rajmohan Gandhi during the last days of JP, a Jaslok hospital in Bombay. And he was told, doctor was very concerned that he might have to take some terrible decision because the hospital had four or five dialysis machines, out of which only two were functioning, one having gone down just hours before. And with JP being on one, he had one for all the other patients. And there was this big question as to what if that one more machine were to go down in the next few hours? What's the call to be taken and who has to be, given this treatment? And he was saying, I wish somebody could fix these machines in the basement. And my husband had some rather rusty engineering skills. But he said, my God, that's horrible. Something has to be done. Can I help? I'm not really qualified on anything, but really, I would like to be of some help if possible. And, he was taken down to the basement. Somehow, after camping there all night long, and he managed to cannibalize the other machines and get one more working. And then after that, basically he was sent around all over India to fix these machines. And the next thing, he knows, he's been asked to even distribute and market these machines. It was like he wanted to be an activist, but he was forced to be a business person at the end of the day. But that kind of thing got him, got him going in the morning, and really didn't care what kind of problem or what kind of challenge was out there. Whether there was no money, there was no technology, there was no technician, whatever, solutions come. So I think Made in India needs to, if that needs to happen, something needs to move inside the hearts and minds of many Indians. People who are qualified, people who are comfortable. Maybe we need to move out of some of us need to move out of our comfort zones and take the chance like he did here and make things happen. Take the onus. I mean, nothing is going to be perfect. Today is great. You have angel investors, you have VC circles, money comes being thrown at you, people chasing you. But it's nice to see this day has arrived. And I think, hope to see that more people will come forth and do things and make the difference. And there's enormous opportunity. If we do it for ourselves, the scale will make it possible for us to do it for the rest of the world. And everywhere there's a need for, affordable, effective, reliable healthcare. So that's the Transation story.
So thank you, Mala. Before I kind of introduce Mr. Atul Chaturvedi, I'm going to leave the group with a speculation. Can you imagine if Kanav and Mala were to work together? So one kind of engages in technology, which is high-end, and the other is a broad-based distribution platform. So that's what comes to my mind, because I've seen them engaging offline in the speaker room as well. So guys, this is all where it started, if it happens. So with that said, we have the pleasure and privilege of having Mr. Atul Chaturvedi, Joint Secretary, Department of Industrial Policy and Promotion, Ministry of Commerce and Industry. He looks after investment promotion in America's leather industry development. Sir, you've heard the panelists, probably missed the first part of it though. We'd like to hear from you. So how's the lion roaring when it comes to fostering innovation, skill development, and the ability to attract investments in India?
Well, thank you, Varun. And I've been hearing a lot from the distinguished panelists and the kind of work which is happening in the field of healthcare. It's really heartening to learn what all is happening and what all is getting made in India. As far as the Make in India and the challenges and the relevance of Make in India in the health sector is concerned, the relevance continues to be same as the relevance for the other sectors, and the challenges remain the same, which were the challenges of the other sectors as well. So therefore, when this whole initiative was launched by our Prime Minister a year ago, on 24th of September in Vigyan Bhavan, the challenges before us were many, but then we will try highlighting some of those challenges and how they are being tackled. As I mentioned, that this also applies to the healthcare sector as well. So I will try covering the health sector as well, along with the challenges which I want to just highlight before you. The number one challenge obviously is because we have made India a very complicated place to do business and a very complex place where there's a number of rules and procedures. So that was the biggest challenge, and how we are going to handle that particular challenge is what we started doing since last 1 year, and there's a number of initiatives which have been taken, and one of the most important obviously is bringing in the competitiveness among the states to start their ranking, and we had a discussion in one-day workshop on 29th of December 2014 where all the state governments were present, and we chalked out a 98-point charter for the states with a timeline on how they need to equip themselves as far as making India an easier place to do business. And based on that, we decided that a ranking would be happening to the states, and we will name and shame the states, and the states which are doing well or states which are doing not so well, and that ranking is going to get out hopefully next fortnight or so, the first ranking, and that has brought in a lot of competitiveness, because that was the biggest challenge, and this challenge can't be tackled at the national level unless you handle it at the subnational level, and on the ground situation has to change. And this competitiveness has really helped us in bringing that particular challenge to be overcome. So that is one very important point, which is one of the challenge. The second is obviously, which applies even to the healthcare sector, is that how we in India can be part of global value chain, because the Make in India is not about manufacturing for India and manufacturing in India, but it's also about manufacturing for the world, and how we can get the global companies to come and manufacture in India, and therefore we have to be part of the global value chain in terms of the accessories and in terms of the final products which has to come out, whether it is in any other sector or whether it happens to be in the healthcare sector. And therefore we looked at some of the policy issues which needed to be handled, and therefore it was looked at as the medical devices were one of the sector which we thought needed to be opened, because there was a tremendous potential for the medical devices manufacturing happening in India, and therefore it was opened up for 100% on the automatic route, and it was taken out, and a carve out was made out of the pharma sector, because pharma on the brownfield was 100% on the government approval route. So therefore, this was one of the issue which was handled in terms of the healthcare sector and in terms of the medical devices, which throws up a huge challenge for us. The third point, which is also handled by some of our panelists here, was about the young India and how this demographic dividend has to be handled, and how we have to see that this demographic dividend doesn't become the demographic bomb tomorrow. So therefore, the whole challenge of job creation and this country becoming the country of the startups and all, and that's the area which obviously attracted us towards the focus sectors of Make in India, and those 25 sectors where pharma and healthcare is one of the important sector to be handled, and some of these areas have a huge potential for job creation and huge potential for the startups, and which was another initiative which was recently announced by our Prime Minister, and we are going to get it launched by the end of this year. The fourth challenge was obviously the R&D growth, where there are over 1,000 companies now in various sectors. Now they have they're now shifting their base to cities like Bangalore and Hyderabad and other places in India. And this is India is now being recognized as a breeding ground for frugal innovation, as mentioned to me by one of our friend from GE. GE Healthcare is taken a number of path-breaking initiatives in terms of frugal innovation, and how the high technology can be made into a kind of a innovation which can really bring down the cost on the healthcare side. And there are a number of such products have been brought out by GE Healthcare, and there are some number of other examples in the other sectors as well. It's like Mars Orbiter. We have gone into Mars, which was one of the lowest value as far as the cost on going to the space is concerned. So these are the other area of the R&D growth which we had to look at. And finally, the most important point is on the scale of manufacturing which we need to achieve. And that's where the generic pharma industry is one of the example where India is the manufacturer of the world for the generic medicines, and we are almost 50% of our manufacturing is exported out of India, and therefore we need to create that kind of scales in the other healthcare products, and especially scales like in the medical devices, where there's a huge import is happening as of now. So that's another challenge which needs to be handled, and therefore all these are very, very relevant for the healthcare sector, and therefore the Make in India in the relevance is in the healthcare sector is very important, and we want India to be a country of job creator rather than the job seekers, and that's where India is offering all the 3Ds for the business to thrive. We need to do a lot of things in that sector. And in the healthcare, there are a number of initiatives have been taken. I'm sure some of our previous speakers in the morning, including the health secretary, must have spoken about it. But then the number of task forces which have been set up for addressing some of these concerns. There's a process of setting up a national level institutions which have happened. There's a cluster development program for creating common facilities which is happening. There is a strengthening of some of the PSUs which has been happening also in the healthcare sector. The development of pharma and bulk drug and medical devices parks, which is some of the programs are now being launched and are underway by the health ministry, and there is also a lot of tax initiatives and financial involvement in ecosystem which is being handled and in terms of the healthcare sector. And there is also a stable and transparent regulatory and pricing environment which is being worked out by the concerned stakeholders in this area. And there is also interdepartmental nodal body for coordinated activities and technical upgradation funds for WHO GMP compliance. So these are some of the areas which are being handled by some of the other stakeholder government agencies, and to see to it that Make in India in the healthcare sector gets succeeded and we are able to create the kind of jobs and kind of growth in the healthcare sector is concerned. And I just wanted to share one of the recent statistics because of just for informing you that in the medical devices and in the pharma sector, which is the healthcare sector classification under the RBI statistics, in the month of June, there has been a 241% growth compared to the previous month of the previous year. So this is a huge upcoming growth which we are seeing in this sector, and some of the major investor countries in this are obviously Mauritius, Netherlands, Singapore, from where a lot of countries are investing through these routes, and obviously UK and USA are the other two countries. So these are some of the top investing countries, and the kind of growth which is happening in the healthcare sector. And obviously combining Make in India with Digital and Skill India, and linking it to the Make in India, which can really contribute to the growth of the sector. And I'm sure these kind of debates and discussions which are being organized by the Industry Association would help in growing of this particular sector and realizing the dream of Make in India with reference to the healthcare sector. Thank you very much.
So thank you, Mr. Chaturvedi, for a fairly exhaustive coverage as far as the talk was concerned. Completely cognizant of the fact that we're holding you back from lunch, but I still want to take a few questions. We'll take two questions if there are any questions for any speaker. So Dr. Brigadier Arvind Lal.
Good afternoon. The question is to Kanav and to Mala Wazirani combined. What would you like? What would be your wish list if you wanted to change something in your, designing and manufacturing, and why?
Are you talking in the context of India, like in terms
no,
of...
right? Yeah, Make in India. So what is your biggest challenge, and what would you like the government to change for you?
I think couple of things that I think that I do see. There is no way we actually know where are the quality manufacturers, how do we actually experiment. There are no experimental spaces, for a innovator to actually go ahead and innovate anywhere. I think we really definitely need that, and it can't just be in IITs. IITs are more interested in very theoretical work. And as someone who's concerned with public health, or even as an industry, we are very concerned about what can reach the market tomorrow as compared to 5 years later. I think we need a lot of spaces around which we can actually go ahead and experiment and move on. One aspect that I think that the government can deeply help in also is to actually come out with a list of priorities. Here are my priorities for public health. So people like, innovators like Nanda Kumar or myself can actually go ahead and say, okay, this is the government's priority list, and this is where we should focus our R&D efforts on, and this is where we should develop. I think that's something that we don't have. And it'll be very simple for them to do. Doesn't require investment. Yeah.
So Mala.
Thank you so much for that question. Really, it's quite a mystery. We would actually, innovators and makers in India who have the made of, or putting that made in India label today, we really want to know that India is with us. We are with India, but is India with us is the question. Of course, the PM is there, and the slogan, and the 18-month, this whole entire campaign for Made in India. I'm so happy. I'm really happy about it. And I hope also that there will be a consciousness that amongst people that really India has arrived. Everywhere in most countries that are doing work which requires gray matter, there are Indians at the back of it. So why don't we also have some faith in products, a greater faith in products, you know, made in India? Why don't we back up? Because making made in India successful will only happen when, you know, okay, 1/6 of the market of the world is using it, which is India. Then you can convince other people to use it.
So right.
Use your products.
So we'll take one more question
One
at this.
one moment, Nishant, if I
Yeah,
may just
sure.
say something. Sir, I would like to draw your attention to the fact and to ask you why in some of the tenders we have to answer, Indian companies need to prove that we have 510K approval for marketing our products in US markets. After we've been here in this country for 35 years, we're already doing 2 crore tests a day. And this then becomes a criteria before we can even participate in government tenders, you know. This is really so awkward. It's embarrassing. I think even the Americans would be embarrassed to see some, although some companies may benefit. I'm all for competition and global competition. I don't think that we Indians need any kind of special treatment because we have it. I mean, we are more advantaged. You know, God has given us something up here, and we have also, you know, we are able to do things our own way, maybe Jugaad or A or B or C, but we have some special resources, right? But at the same time, why should companies from out of India have more advantages than Indian companies? Is my question. And the second question is that uh, it's very strange that those companies are not asked to prove their technologies when they come to India. It's just taken as given that they are much better. They are, you know, following all the standards, and very often we find that their products are substandard. But because they are imported, they somehow get this halo. And our government needs to put them to the test. Really.
Agree.
Okay? And then we'll compete. More than fairly.
So Mala, as I understand from Mr. Chaturvedi, he may not be the best guy to answer all of these questions on this table. So probably we'll table it to the right audience. If there's something that somebody would ask, yeah, so I see the lady right at the back.
Hi, thank you. My question, I guess, is addressed to the Joint Secretary. Can you hear me?
A bit louder, please.
Can you hear me now?
Yes.
Okay, my question is addressed to the Joint Secretary. I understood that the government has done a lot in the last 12 months to improve the ease of doing business, and as you outlined, a large part of that has been to looking at increasing competition between the states to make them more accountable at state level.
Would it be fair if you can come a little forward? Thank you for that.
Is this better?
So why don't you use a mic which is somewhere on the seats?
Why don't you come up? Why don't you come up? Yes. Yeah, mouth has to be.
Is that better? I can just come up to the table.
Yeah, please, why don't you come up here? Please come up here.
Basically, I just want to understand, we've spoken about competition between the states as one way to address ease of doing business in terms of perhaps labour reform, land reform and other issues. In terms of India and the world, you also talked about global value chains. There was a lot of liberalisation in the 1990s that I think worked well in terms of being able to look at inputs as well. So I guess part of manufacturing is also the expense of inputs that may come from overseas, as well as obviously wanting to export. So I guess my two questions are, in terms of global competition, would more liberalisation at the border in terms of tariffs help drive up Indian quality and also then improve brand India? Because there's perception and there's reality. So if brand Indian quality is already very high, allowing for transparent and actual competition by allowing products that are foreign and domestic to compete at level would allow you to, I guess, improve the brand of Indian products. And then the other element is just inputs into the manufacturing. Would liberalisation of tariffs at that level as well improve India's Make in India campaign? Thank you.
If I understood your question correctly, what you're trying to tell was that we need to bring in some sort of the quality competitiveness between the products imported and products Indian, right? Is that what you said?
That's one element, yes.
So her element was that if the products today in the market are competitive, then they should be allowed to operate at a level playing field. There should be no tariff barriers, as I understood her speak. So you also alluded to the fact that you will have a comparative index when it comes to the states. So that's the second point that she alluded to.
See, as far as the tariff barrier on the import is concerned, or between the export and import, we have to see that we don't land up having any kind of an inverted duty structure in terms of the raw material coming in at a higher tariff while the final product is coming in at a lower tariff. So therefore it has to be the right kind of a mix to ensure that the taxations or the import duties are put at the right places to give a kick to the manufacturing in terms of whether it is in pharmaceutical sector or whether in terms of any other sector is concerned. So therefore that competitiveness can only come in if we have to see to it that we don't land up having a higher tariff on the finished products rather than in the raw material. And therefore we have to see, and then we have to, at the end of it, the whole tariff structure has to move into the direction of giving a push to the manufacturing, because that's a story which India has missed in past, and we don't want that story to be missed, because this is the last opportunity for India to increase its manufacturing and to get the job out of the manufacturing and to also lead the world in terms of manufacturing. As far as the other point, which was regarding the state competitiveness, that is what I mentioned in my thoughts initially, was that we need to handle it in a way so that the competitiveness is really comes out in a very clear direction, and that's why this ranking business was started. And this ranking will certainly bring in a lot of competitiveness and will throw up the states which are more friendly to do business and more friendly for the investment, whether it is in the pharma sector or for that matter any other sector. And therefore, this is the only way we thought was the competitiveness could come in the states. So that, I hope I have answered your question.
So I thank you. That will bring us to the end of the session.